Hi, my name is Lori. I'm one of the surgical assistants here at New Image Surgical Center. Today I'm going to go over the post-operative instructions with you for having oral surgery. When everyone leaves our office, you will leave with a post-op piece of paper explaining everything that you need to know. On the first line here, it's going to talk about post-op bleeding after the procedure. When you wake up from your surgery or when your surgery is over, there will be a small piece of gauze in your mouth where the surgery was done. You're going to leave that gauze in your mouth for 1 hour after surgery. Then you're going to take out the old gauze. You're going to look in your mouth. If the area is still bleeding, you're going to take a gauze, roll it into a small square, place it back in that area for another hour. If you notice that after that hour it is still bleeding, you can place in more gauze. It is normal to have multiple gauze changes after a procedure. After surgery, we ask that our patients do not spit, rinse, or drink through a straw for 24 hours after surgery. This is very, very important. Also, if you're a smoker, we are going to ask you to not smoke for 1 month after the surgery if it is possible. The day of the surgery, your mouth is going to be very, very numb. So it's very important that you stick with foods like ice cream, jello, and pudding so you do not burn your mouth. The day after surgery, you can do normal foods, whatever you feel like, but I would still stick with a soft diet. You can do warm foods the day after surgery, like soups or mashed potatoes. Also, it is normal to have swelling after the surgery. Peak swelling is 3 to 5 days after the procedure. So it is definitely normal to be swollen for up to 1 week. If you have a bone grafting procedure done, it is very important that you avoid anything acidic or carbonated for 2 weeks after surgery. That will make sure that the stitches do not come out too quickly. As far as hygiene goes after surgery, you're going to start brushing your teeth the day after the procedure. Most of the time, if you have your wisdom teeth out, there's going to be holes down here in the lower jaw where the teeth were taken out if you have all 4 of them removed. You're going to have to start to keep that clean 2 days after surgery. So if you have your surgery on a Friday, on Sunday, you're going to fill this syringe up with the prescription mouth rinse that we give you. Put the tip of this into the lower holes and you will flush out the food. You will start it on Sunday and you will use it for 1 week after every meal to keep the areas clean. If you have stitches, depending on what type of surgery you've had, they can dissolve on their own up to 5 to 10 days after the procedure. Sometimes they come out a little earlier than 5 days, sometimes they come out a little later than 10 days. It does not make a difference. If you are concerned, feel free to give us a call with any questions that you have. As far as exercising goes, you want to avoid anything strenuous, heavy lifting, a lot of bending over for about 4 days after the procedure. You are also going to be given some prescriptions for after your surgery. Everyone is given antibiotics. If you have antibiotics, then you're going to start taking them like it says on the prescription. The mouth rinse will start the day after surgery, just gently rinsing, because you cannot rinse for 24 hours after the procedure. The pain medication that you're given is only as you need it. And then some patients are giving a steroid, which is called Medrol dose pack or prednisone, to help with swelling after surgery. If you are given that, please be sure that you take the 6 pills for day 1. You can take them all at once prior to bedtime the night of the surgery. You will start with day 2 like it says on the package. And then everyone's also given, if you are sedated, you will be given an anti-nausea medication, which is only as you need it. You can also take 1,000 milligrams of Tylenol with 600 milligrams of Motrin or ibuprofen for pain. If you take those medications together, it will work like a narcotic without the side effects of a narcotic. Our office phone number is 919-841-1720. If you have any questions, feel free to give us a call. Thank you so much for watching my video.